Good afternoon. I'm Ukomadu. I'm and Debimla, New York. I was asked to say just a few things. So I'm here at the 2013 National Convention, and we just got finished as a part of the Young Professionals group of having a presentation about our trip back as a part of a medical mission. We had a number of us that went back, spent about a week at home, did 2 days of medical screenings, and we were able to reach somewhere in the vicinity of about 950 patients who did not have access otherwise to medical care for mostly chronic illnesses and some pain issues. So I guess the big push that I'm making today is to let people know that this is part of an ongoing agenda to provide access to care, as well as promote some awareness of the health concerns and issues that exist back home, and to let people know that there's definitely a way to contribute both in personnel as well as financially through our website, which is youngprofessionals.com, and there are a number of portals there to get in touch with us as well as to contribute.
What was the most common ailments?
We saw a lot. That's a great question. We ended up having a lot of both screening materials and instrumentation, as well as drugs for hypertension and cholesterol issues, which do reflect some of the issues that we see in our community here. But when we got back home, it was pretty clear that simple things that we take for granted, like simple analgesics for chronic pain, for everyday aches and pains, which are not readily available, was also a big thing. There's also many chronic illnesses, from an infection standpoint, for instance, that were not being adequately treated. So just simple antibiotics were in heavy demand. And then things that are so considered part and parcel of the life of the everyday Nigerian, anti-malarials. Those, as soon as we got them, we ran out of them. So big things. There was a lot that we learned being there. But the big things we saw were pain issues, infections, and malaria for sure.
The thing is, for the last, I think 10 years ago, we had a medical mission that was done by the older people, and they were the same exact concerns they had. Absolutely. What the concern I personally have is, and I'm sure people who are a little more intelligent than I am, is you have someone who has managed high blood pressure without any medication, and then you suddenly put them on medication,
right,
and they run out. What process is there in place to address?
That was a question that really conflicted a number of us, a number of the medical professionals that was there, medical professionals that were there for that trip. And one of the things that we were lucky to have was some input from some of the staff that was there, that were based on the ground there in the area, the indigenous area that we were. So that was good. We were able to ensure some level of follow-up, okay, although the same issues exist after we leave as they existed before we got there. Access to care primarily because of financial resources, or lack thereof. So one of the things we were able to do is create some sort of a link to some of the professionals that were there on the ground. But to be totally honest, we knew that to a certain extent that we were providing a stopgap measure.
So what you basically was put a band-aid on something that required suture.
Absolutely, and you know, it leaves you with some interesting questions, whether or not it's better leaving them alone than treating them. So the other question I want to ask is this, and I think it's very important that do you guys have a database that you're collecting of these people you're seeing? We absolutely, So one of the things that was imperative to us was to be as precise and systematic and thorough with our documentation as possible. So we know with some certainty the number of people that we served, for instance, because we created charts on all of those people.
Do you have names?
We got absolute names.
So if you go, how do you identify them? Are you identifying them by name, or do you have fingerprints, or do you have pictures?
We don't quite have biomimetic documentation at this point, just because of the limitation of the resources that we had at the time. But we have as good
records,
biographical information as we could get. And the thing that's amazing about back home is, you know, while the infrastructure is still rudimentary in so many ways compared to what people are used to here, At the same time, people have 3 and 4 cell phones to be reached by. So we do have some ways of getting in touch with folks. And we absolutely know that if we were in the same area, just given what we saw in the 2 days that we were there, if we're in the same area and people get the word that we're there, I don't think people coming back is as much of an issue as much as getting the word out that we're in that area.
Have you reached out to other organizations that conduct medical missions out within the Nigerian community?
Absolutely, absolutely. So we didn't do, nothing that we did was done in a vacuum.
Okay.
So there were a number of organizations. There was a local political foundation which had a health resource arm that was involved. There was local professional groups, so Nigerian Nurses Associations that were involved, as well as I mentioned before, local physicians that were indigenous to the area that we were in. So it was still a huge task and undertaking for the NYP to put on, but it would have been even more momentous had it been done by the group by itself. There was absolutely the support and a concerted effort from a number of different organizations that really made it possible to do what was undertaken.
One question I want to ask, and this is something that's come up quite a bit, an issue of trust. Mm-hmm. So you go and you have local physicians, and maybe local nurses. How do you stop them from selling the medication that you give?
Yeah, that's a good question. It wasn't one of the highest priorities. There was so many of those you could call them ethical issues that presented themselves as we were there. One of the things that we hope mitigated some of those issues was the distribution method in which we gave out some of the medication. So we had a freestanding pharmacy which was manned by volunteers from our group, which had it was essentially separate from what was going on with respect to the screening process and the diagnosis and treatment arms of the mechanism that we set in place to treat the people. So what we did was we had the physicians diagnose and prescribe their medications, and it went to a totally separate arm. So there was actually very little. If it went seamlessly, there was no interaction between the actual physician and the pharmacy. So,
now, the question I want to ask is: have you guys approached NAUSA and asked them for funding? Because NAUSA used to conduct medical missions,
absolutely.
And NAUSA would love to continue.
It wasn't NAUSA; it was the Health Foundation, which is an arm of NAUSA. So maybe we're being semantic.
Yeah, there is well, we're not going to get into discussions, and the reason we're not going to get into discussions is because there are so many issues regarding NAUSA and Ukomadu Health Foundation.
Okay.
So I'm going to ask the question again. Have you guys approached NAUSA itself and asked them to sponsor the next medical mission?
Oh, absolutely. There's definitely. I've probably talked to, just this afternoon, 3 or 4 of the executives.
Just the president.
Just given I haven't talked to him specifically, although I can't say that I'm a representative for NYP, so that's not to say that conversation hasn't happened.
Tell them to send a written request for funds.
Oh, absolutely.
And are you registered as a non-profit or a for-profit organization?
It's a non-profit organization.
Okay.
Yeah.
So if you can make this is me telling you as a citizen and also a member of the council, send a written request for funds. Detail what it is you're looking to do. It falls under the auspices of the reason why we're granted the 501c3 status, and then the executive will present it to the council, and then the council can either approve or deny a request for funds.
I think that's definitely something that'll be forthcoming, especially given the conversations that we've had in the past. And I can't be 100% certain that the steps exactly haven't been taken in the future.
Well, I'm in the council. I've not heard anything, so.
Well, you would know better than me.
So last one, you're a physician?
Yes, sir.
What's your area of specialty?
Orthopedic surgery.
Okay.
Yeah.
Thank you very much.
Yeah, absolutely.
Dr. Ukomadu from New York.